Hello and welcome to the Federal Series on Health and Wellness. I am Giri Prakash, the host for this interaction. We have with us Ms. Susanna Schaefer, who is the Executive Vice Chair and President and CEO of Smile Train. It's an international organization focused on empowering local medical professionals to provide free cleft, lip, and palate surgery. And along with Ms. Schaefer is Ms. Mamta Carroll. She's the Senior Vice President and Director Asia for Smile Train. Let me tell you a bit about the issue as far as cleft lip is concerned. I understand that there are 1 in 700 children globally is born with a cleft lip or a cleft palate or both. In India alone, this translates to more than 100 babies born with clefts every day. In simple terms, the cleft burden for India is over 19 lakh patients, with over 50% of these in the age group of 0 to 25 years. Annually, around 35,000 Indian children are born with clefts, and hundreds and thousands of children in India live with untreated clefts due to ignorance and poverty. The children not only live in isolation, but more importantly, have difficulty in eating, breathing, hearing, and speaking. Many are malnourished, weak, and often suffer from ENT infections, and that has led to a situation where they often drop out of school and find it difficult to get meaningful employment when they grow up. Apart from the fact that there's a whole lot of stigma attached to it. Let me start my conversation with Ms. Schaefer first. And if you could sort of throw some light on what is happening globally and how serious is the situation.
So the numbers are correct that you had shared. It's 1 in 700 births are affected by cleft. And so on a global scale, that averages out to be about 200,000 cleft births per year annually. And that's the figures that the WHO uses for cleft and what we see at Smile Train as well. So when you think of our programs on a global scale, we're treating approximately 100,000 cleft patients per year at this moment. So that gives an idea of the breadth of Smile Train's work around the globe. We're working in over 70 countries around the world actively at the moment. Over time, we've worked in over 90 countries around the world. We were founded in 1999 and in our 24th year, this year of operation. And in that time, globally, we have treated over 1.5 million patients around the world, giving them, the surgery that they need to go on and thrive.
Mm-hmm, mm-hmm. So as far as India is concerned, if you could share with us how the situation is, apart from the fact that I came out with a few data, but I would like to know more about in terms of how serious is the situation here. Ms. Carroll, over to you.
Right. So, as you mentioned, the incidence of clefts, which is 1 in 700, and you rightly said that when you translate all of that to a country like ours, to India, 35,000 children are born with a cleft every year. Now, we also take into account the backlog, which is existing when we're talking about the treatment that we are providing. So, how are we kind of handling that? And which is like, we have a huge partner network in India. We have like more than 140 partners in the country, in almost all the states, 110 cities in the country, which is a good spread as far as the cleft treatment is concerned. And the treatment or the comprehensive care treatment that Smile Train provides is for everybody, is for anybody who cannot afford. And that treatment is like completely free of cost. So whether you're talking about the first surgery, you're talking about comprehensive care in terms of speech therapy, nutrition, orthodontics, all of those services are provided by Smile Train via our partner hospitals, completely free of cost to anyone who kind of comes into our partner network and requires that kind of treatment. So this in nutshell is the scope and scale of our programs in India. And to the tune of, if we just talk about cleft surgeries every year, it's like more than about 37 to 38,000 surgeries is what Smile Train India is supporting annually in for our programs in the country via this network that I spoke about.
Oh, okay. One common theme that I find is that this is more prevalent among the poorest of the poor, or the poor, or the lower middle class. Is there a class distinction there, or is there something really the way it arises out of more out of malnutrition among the mothers? How exactly does this happen?
The real issue is not the prevalence among the poorest of the poor. The issue is it is a birth rate of 1 in 700. It's the access to care that's the problem. And that is the role that Smile Train is trying to play in that, by providing access to care in low resource countries. So like where I'm from in the United States, cleft is still prevalent. Cleft is still 1 in every 700 births, but there's access to care and children are treated at a young age, where in low resource countries, you don't see that. You will see untreated clefts. So our goal at Smile Train, when I had previously said, we're treating approximately 100,000 patients per year. Our goal is, how do we get to that other 100,000? We want to get to those untreated cleft patients at the youngest age possible, so that they have that life-changing treatment and can go on and thrive at the youngest age possible. And we've made real inroads here in that in India alone, with, as Mamta had shared, the number of patients we're treating on an annual basis.
So is it more difficult as the years go by, as one person ages? How is it? And also the kind of cost that is involved in these kind of surgeries?
Right. So I'll take your questions one by one. So when we talk about, patients coming or people coming to Smile Train partner centers at a later age, of course, because the treatment of clefts has a clear pathway, and that is, 3 months onwards. So that's, decided. There's a complete protocol, there's a treatment pathway. And ideally, the best treatment is provided at the right time, at the right age, and at the right instance. Of course, when a person kind of misses all that timeline and comes to a Smile Train center at a particular age, or at, in terms of adulthood, and when the person is kind of grown up a little bit, of course, that comes with its own challenges. So that really depends on the severity of the condition. So if it is just a cleft of the lip, or the palate itself, or both, then the quality of life of the person is compromised to a large extent. So the basics of eating, speaking, breathing, all that is affected when the treatment is not kind of done at the right age and at the right time. So therefore, when we have these protocols, when we have a treatment pathway, and we always tell people the awareness bit and everything, that this is the protocol that needs to be followed, and to kind of work with other agency. I think that is what when Smile Train India kind of rolls out all its programs, and the way that we kind of focus is, and the key to this is partnering with government agencies like the RBSK, or the Federation of Gynecological Societies of India. And via these important partnerships, we are able to get to the child with a cleft at the right age, at the right time, even before the child is born. So we have, under this partnership, we are looking to spread the message, to sensitize people, to train people on how to kind of, get to that right age, even before that, prenatally as well, to see that how can Smile Train provide that support in terms of counseling, in terms of nutritional guidance, or of feeding advice, and so on and so forth, because that's very, very important in the cleft care pathway. So therefore, these partnerships which are ongoing, with Smile Train India are so important for organizations like ours. And when we talk about donations, when we talk about fundraising, majority of our fundraising is done outside of India, and that's we are getting most of the funds from there. But India itself is a huge potential. It's a in terms of corporate funding, as you know, in terms of our CSR obligations and CSR laws that we have are so good now. Recently we have started all of this. So therefore, more and more corporates are joining hands. They are coming together. For corporates which have a focus on healthcare, definitely, it's very easy for them to come and join us and support us in terms of donations and in terms of incorporating the cleft cause in their CSR activities. So that is what they're doing currently. And we're also looking forward to, so every year we are looking forward to kind of joining hands with more and more corporates and basically, telling them to support us in this cause, for this fantastic cause that we all working for. And Susie, if you'd like to add to some of the our donors and how do we go about those?
Sure. So from a global perspective, the majority of the donations and funding to fund our programs comes from the United States. That's where Smile Train is headquartered. We're in New York, and we have a very large donor base that supports our global efforts for cleft treatment and care. The majority of those donors are private. It's private individual giving to Smile Train. We do partner with, on a global scale, 2 large corporates, just to cite a few. One is Haleon. We are their partner with their consumer healthcare business. And then Dentsply Sirona. We also partner with them on a global scale. And we have wonderful programs with them. They are global, large corporations that have, are grounded in many of the countries where our cleft treatment programs are taking place. Our morals and values really align with, our focus on oral health care, living better and healthy to do good. And so we have really, really nice employee engagement programs, as well as just financial support of our cleft programs. So they are wonderful global partners, but as I said, it's interesting in our work that the majority of the funding comes from individuals.
Oh, okay. So the note that I was handed over also said about how you actually train doctors as well. So how does it work out? Do you do on an individual basis? How much does one have to spend on each of these surgeries?
So our model is based off of a teach a man to fish model. Our goal is to build capacity in countries, low resource countries, and to build a long-term sustainable system for cleft treatment and care. We don't fly medical professionals from the US or from Europe to low resource countries to treat children and leave. We focus on building that capacity so local medical professionals can treat patients in their own countries. They know best. They know what treatment is needed, and we're there to raise the awareness and funding on a global scale to be able to fund and provide the resources needed for this local cleft treatment. So it varies. As I said, we're working in over 70 countries around the world. So it varies with regards to the cost of surgery, and it varies with the funding that's required to train surgeons. But I think what's important is to understand how that program, from an education and training perspective, works specifically in India. So I'll turn it to Mamta to speak to that.
So when you look at capacity building and training, I think as Susie just said, and I'm going to repeat a little bit there, she said the teach a man to fish model. So because we work only with local doctors when we enter the country, and coming back specifically to India, so we only work with local Indian doctors. And therefore, it's just not the cost of the surgery or the comprehensive cleft care treatment that we are kind of funding them with, because we also work on knowledge transfer. We also work, I mean, they are a partner, so we work cohesively with them to transfer that knowledge, to train them further, to do skill enhancement, not just for them, not just for doctors. So we're also looking at trainings for like the support staff, the nursing staff, the post-op staff, the OT staff, or the orthodontist, or the speech therapist, and training is in SmileTrain's DNA. And therefore, when we look at funding a hospital or a partner, and if I tell you that, you know, let's say 25,000 rupees is on an average the cost of one single intervention that we kind of giving the partner hospital, right? But we're only looking at the intervention part of it. Now, let's come to the other funding aspects, which SmileTrain is funding the partner hospital for, which is also training, which is also capacity building, which is also infrastructure and equipping the partner hospital in terms of, you know, any gaps that they may have in the safety standards that we kind of, you know, expect them to be at. So whether it's an anesthesia machine or any other safety or life-saving equipment, all of that is funded by SmileTrain again. So when you look at holistically and the kind of cleft care treatment that SmileTrain is funding, it's every aspect of the treatment. It's not just that one intervention, we give it to them and we say, okay, this is it. Training, capacity building, equipment, comprehensive cleft care. So all of that again contributes to everything that SmileTrain funds at a partner hospital. And that's what the partnership is all about.
Do you work closely with the local, public health centers, PHCs as they call it as, which actually are there in almost all the villages, or cluster of villages? And also the other question that I want to ask you is whether the doctors whom you train, do they do these kind of surgeries without cost?
So when we talk about PHCs and other facilities which are already available, I think those are excellent resources. And I've already detailed before that we have very strong partnerships with the local health department and the ministries of health. So there is a partnership with RVSK teams and, you know, NHM teams where they facilitate the first screening or they facilitate outreach for SmileTrain. So under this partnership, they, along with the regular things that they have to do in any case, they also help us with identifying children with clefts, identifying those families who need the help, and then directing them to our partner network. So that partner, under that partnership, we are already working together very closely with them. That's one side. Now, when we talk about funding, yes, we fund the partner hospitals, we fund the doctors, we fund everybody. So we give them this funding, and it is up to them how, you know, they kind of, because we fund them per intervention. So of course, the surgeon, the anesthetist, and everybody kind of receives definitely some amount of funding, you know, as a consequence of the SmileTrain program. So yeah, they're all in partnership with us. That's how they work.
When you talk about education or informing the public, and I would like both of you to actually answer that, one from the global perspective and one from the domestic perspective. What are the social issues that you confront, and how do you solve these kind of issues? Because there's always this issue about actually going to a doctor, going to a PHC or government hospital doctors, because of the fact that there is, of course, lack of awareness, and there's a whole lot of stigma also attached to it and issues like that.
That is actually a very large part of our work, especially in the US, where most of our focus, because we're not treating patients in the US because there is access to care, our focus is really the raising of awareness of the severity of cleft. So the life challenges that untreated cleft patients are facing, and their families, so which is educating on the severity of cleft. Cleft patients have trouble eating, breathing, speaking, as you had stated in your opening remarks. So it's explaining what that is, and especially in a market like the United States, where there is a misunderstanding of the severity of cleft because it's just not seen. So it's not well understood that this is a medical condition. This is not a cosmetic problem. This is a medical problem. And this is where Smile Train's role is in that. In addition to that, it's speaking about the stigma, because again, there is such a lack of understanding in locations like the US or even the UK, which is another location where we are raising awareness and funding for our global programs. There is access to care in both of these places. So yes, patients in the US or the UK could be facing stigma for their facial difference, but it's just not understood on the severity of having cleft, where a patient and their family could be dealing with social stigma, isolation. So we do a lot of awareness generating, education generating of cleft, what it is. There is no known cause for it, but there is a need to treat it. And in low resource countries, the need for that support for our patients is paramount. What did you want to talk about? Yeah.
Sure. So as you know, India has its own challenges as far as myths and superstitions is concerned. And I think Smile Train India is really committed to building awareness, one, to reduce stigma and show acceptance for people with clefts in India and around the world, definitely. Educate people that clefts are common and treatable, and that Smile Train is here to help at absolutely no cost. And therefore, besides partnering with government agencies and other NGOs, which we do, as a consistent kind of initiative from the organization as we speak, all the time, and we give separate funding for awareness to our partner hospitals and to all of these agencies to conduct this, because remember, no one agency can do this. In a country like as large as ours, just Smile Train India's efforts or somebody else's efforts, not just one thing doesn't work here. We have to kind of do everything, which is kind of built into everything and merging into everything to tackle this, especially the awareness bit, which is like huge here. So therefore, all the efforts need to be combined. So we do that via our network, as I said, whether it's a social worker, whether it's outreach, whether it's RVSK teams and FOXY and so on and so forth. And the other side is the initiatives that we as managers take in Smile Train India and how we spread that. And one of those initiatives, which I'm very, very proud of, is called the Cleft Con. When the cleft community gets together, and it's we launched it last year in India. It's a yearly event. We are going to have one in Pune in May. So that's a big thing. That's a big event when all these people come together and on a very close knit platform. We talk about these issues. We spread awareness and so on and so forth. So that's really important. The other is forums like this. So we are right now in Belgaum at the Indo-Cleft Con 2023, where we are discussing not just the medical aspects of the treatment of clefts. We are also discussing the psychosocial. We are discussing counseling. We are discussing the other aspects of the cleft cause, which will go a long way in kind of ultimately spreading awareness and saying that this is completely treatable. We have centers like the Cleft Leadership Center in Bangalore, which is like a complete comprehensive center where every aspect of the cleft care treatment is available to anyone who needs it at absolutely no cost. from training to treatment, everything is provided under one roof to this, where the teams get together and, give this holistic treatment. So I think this model works really well, not just for treatment, but also for awareness.
One thing that I want to know was, is there a common theme among all the countries? Because the fact that you are so closely associated with health awareness and medical intervention, as you say, which runs through almost all countries, or are there any specific issues concerning, say, low resource countries compared with those which are developed?
I'm sorry, I
Sheffer, if
missed
you can take that question.
Yes, I'm sorry, I missed just the beginning of your question. So I'm sorry to ask you to just repeat the beginning.
Yeah, sure. What I wanted to know was that Smile Train is closely associated with health awareness and medical intervention in almost all the countries. And I wanted to know whether there is a common kind of trail or a theme which runs across each of these countries, or are there any specific traits which are only for low resource countries compared with the developed nations?
Yeah, thank you for restating that. I would say what is similar is the cleft. The cleft is similar, but globally, we are at different stages of our programmatic evolution, let's say. So there are countries that require, say, more education and training. There are countries that require more equipment, so they need capacity building because, we as an organization we started in China and India in 1999, but we didn't start working in Africa until 2006. So we are a bit behind there. Plus the fact in a continent like Africa, when we first started, there was one plastic surgeon on the whole continent. So we had to make, really targeted inroads in education and training of medical professionals. And capacity building is still an ongoing issue on a continent like Africa, whereas because we started sooner, and there was more of an infrastructure in China and India, we were able to grow those programs from the start. And then, when you look at, let's say, Latin America, they are more established, although they are still low resource settings. So more of our focus is on comprehensive care because their surgical capacity is at a certain level already, which we see in some locations here in India. It's similar, and Mamta can speak a bit more to that. In the larger cities, right? If you look at the radius, we're able to treat patients closer to larger centers, more established centers. You'll see more patients are treated, but then in more austere settings and outlying areas, there is a need for more capacity building, more education and training.
The more you do for awareness, the less it is. So I think the common factor, which is I can speak from a perspective specifically for South Asia, Southeast Asia, and other nations, is that a concerted effort, a joint effort between various parties. I think that is the need of the hour. For cleft to be recognized as a cause to be concerned about, not just a cosmetic problem, but a cause which really affects the entire well-being of an individual. I think that awareness is so important, and therefore to all of us to come together to talk about it so that we can get this recognition from the governments, from the health agencies, from the ministries to recognize this as a problem, to recognize this as a cause of concern, to recognize this, that how can we, come together and talk about it, and therefore is equal to leading to awareness, and therefore equal to leading to a timely cleft treatment and intervention. I think that is what is really required. And I think that's a common factor between all of these countries that is so essential, which I see everywhere. So whether we are talking about a Bangladesh, or whether we are talking about a Vietnam or a Thailand, or Myanmar, this is what we are all struggling with at various levels. I mean, we may be very, very different in terms of how our health systems are set up, but this is one common thing that we all discuss, is that how do we create this awareness? How do we sensitize people? How do we have people come together and talk about it?
Sure. Thank you, Ms. Sheffer, and thank you, Ms. Carroll, for taking time off to talk to the Federal. It was a very interesting conversation. Thank you very much.
Subscribe to the Federal's YouTube page for more interesting updates.